Hi, my name is Lauren Lippy. I am a registered nurse currently practicing in upstate New York. Prior to nursing, I studied music performance. I have a bachelor's degree in bassoon performance and a master's degree in bassoon performance and wind band conducting. And when I first started nursing, I spent my first few years working in the intensive care unit during the COVID-19 pandemic. And as I began to adapt to these new stressors that I was experiencing, I started taking a personal interest in researching burnout, performance anxiety, and I found that a lot of the different coping mechanisms and interventions that I was looking at were 100% applicable to my musician brain as well. And a concept that I had came across is called overtraining syndrome. And today I just want to do a brief review of overtraining syndrome found in athletes and its application to music performance artists. Our objectives for today: we are going to establish the relationship and similarities of the physical demands found both in athletic and musician training environments. We are then going to define and discuss overtraining syndrome with a brief review of the pathophysiology. And then we're going to discuss non-pharmacological and non-invasive interventions to help manage and prevent overtraining syndrome in musicians. So let's compare athletic training versus music training. There is definitely a recent increase in the literature as far as awareness of the physical symptoms experienced during music training that has only validated the physical demands and endurance needs that musicians require to be successful. And adding another layer of that, it is found that during feelings of music performance anxiety, these physical symptoms are only heightened. And in a critical review of music performance anxiety, there was actually a direct comparison of athletic training to music training, as both utilize repetitive use of muscle groups with the intent of aiming at presentation. And we can define athletic training as specific repeated body movements performed according to a planned program in order to improve or maintain one or more elements of physical fitness. So we can obviously identify the physical similarities between musicians and athletes. As musicians, we're in the practice room for long periods of time, playing our instrument, manipulating our bodies in unnatural ways, the same muscle groups to get better in our performance, musical endurance, and technicalities. Training itself. I just want to create kind of like a baseline understanding of what training is, and so we can focus on the physiologic aspect of it. So training is intended to disrupt the homeostasis of our bodies, which then causes neuromuscular fatigue. So homeostasis is the body's equilibrium. This is when the chemistry and body systems are all working together as friends and everything is functioning as it should be. Training puts a direct disruption in this process. So we require rest and recovery in order to regain a new level of homeostasis. So once we disrupt our homeostasis, we require the adequate rest and nutritional replacement to allow our body to establish this new normal that then adapts to the original stressor at an improved performance level. And this is when we start to see actual progress in our training. So we have this training event. We're disrupting our homeostasis. We need that rest and recovery. We regenerate that new level of homeostasis that then adapts to the original stressor at an improved performance level. So what is overtraining syndrome? Overtraining syndrome is a complex clinical disorder that represents a maladaptive or bad response to the high training volumes done to enhance performance. So our body is not recovering as it should, and our performance starts to decline. There are 4 different phases of overtraining syndrome, and as we get through each phase, the symptoms worsen and increase with each level, which then just delays recovery. So first we have our acute fatigue. This is an immediate result of our training event. This is the normal fatigue felt following the event. There is no additional recovery time needed, and performance is not affected. Functional overreaching is a short-term decline of performance associated with an increase in training load. This training load can be intentional. There's actually studies out there that show that this intentional functional overreaching can actually have a greater effect on your progress and performance with the adequate rest and recovery. There's usually less than a 2-week recovery time. Basic rest and recovery allows you to get back to that new homeostasis. When we're not recovering in this overreaching time period, we then get into non-functional overreaching, where the physical symptoms begin to increase. We start to introduce our psychological symptoms as well, and we can take up to 2 months for rest and recovery to gain a better sense of performance. And when we don't have that adequate rest and recovery, that's when we get into overtraining syndrome. So overtraining syndrome is a prolonged, greater than 2-month decline in performance. This is when your physical and psychological symptoms are unmanageable with just basic rest and intervention. And this maladaptive response just increases our physical and psychological fatigue, and we need to start seeing our healthcare team to create some individual interventions to specifically help what we have done to our body. So, the science behind overtraining syndrome. As humans, I think it's very important that we all have an idea of how our body functions, because then it just helps us understand why we need to do the things that we need to do in order to appropriately rest and recover. Now, there is no single theory that outlines overtraining syndrome. There are various hypotheses that all generally center themselves around the same context. We have this idea of autonomic nervous system imbalance, glycogen depletion, central fatigue, and cytokine release. Autonomic imbalance is the dysregulation of your autonomic nervous system, which is a 3-part system that controls the things that we don't consciously control. So things like your heart rate, things like your blood pressure, things like your GI system and the way that it moves throughout your body. These are all things that we don't consciously control, that your autonomic nervous system does. And it is a 3-part system that makes up of the greater autonomic system. There's the sympathetic nervous system, your parasympathetic nervous system, and your enteric nervous system. Your sympathetic nervous system is your fight or flight response. This response is the cascade of events that happens when your body feels like it's under attack. There's a lot of hormones that are secreted. There's a lot of energy being used. And your parasympathetic nervous system is the opposite of that, where it's our rest and digest. And this is how we recover from that fight or flight response. Your enteric nervous system has a lot to do with your GI system and the way that your GI system moves water and electrolytes through the nutrition that you put into your body, which has a direct effect on our homeostasis. And it also affects the movement of peristalsis. And peristalsis is the actual movement of your intestines in order to move everything along. And when we have disruption of our autonomic imbalance, our autonomic nervous system, that's when we start to see symptoms, GI symptoms such as constipation or diarrhea, because that peristalsis is affected. Ultimately, this all leads to branched chain amino acid consumption. And we'll talk more about this BCAA consumption on our next slide. The next theory that I want to discuss is the glycogen depletion. So glycogen is a concentrated form of glucose that is immediately ready for use in fight or flight responses. So when our muscles utilize that immediate energy source, it then triggers our body to use the branched chain amino acids to convert them into glucose. So then we can use that glucose from those branched chain amino acids in order to make more glycogen for our muscles to use in this fight or flight response. This decrease in serum BCAA levels ultimately leads to central fatigue. And what is central fatigue? That decrease in your branched chain amino acids leads to an increase of serum tryptophan. There are a lot of amino acids. They all do various different things. They're all needed for energy and cell function in general. Tryptophan is an aromatic amino acid, so on a different family of it. And tryptophan is responsible for the production of melatonin and serotonin. So when you have an increase of this level of tryptophan in your body, more tryptophan crosses your blood-brain barrier, converts that 5-hydroxytryptamine or serotonin, which then leads to those mood changes and imbalances. It's also thought that overtraining syndrome is related to cytokine release. Cytokines are proteins that are secreted during periods of stress and inflammation, and the prolonged cytokine release affects our central nervous system. They are believed to aid in the transmission of pain, and so when we have this prolonged secretion of these proteins, our central nervous system becomes tired, and we start to see peripheral fatigue and hormonal and metabolic changes. So what does that all mean? Takeaway: the body does not recognize a good physical stress from a bad physical stress. Training is seen as a stressor on the body, and the nervous system reacts in such a way, typically initiating its fight or flight response. And in this response, we utilize all of the immediate energy stores that we have in order to compensate for this strain on our muscles. And this prolonged strain of our muscles and continuous depletion of these needed energy sources without adequate rest and recovery does not allow us to get back to that new homeostasis. And that's when we hit our overtraining syndrome. So, what are the signs and symptoms of overtraining syndrome? 1, overall decline in performance. Duh. We have a decrease in the ability of our performance, our physical performance, psychological performance. We have fatigue, persistent muscle soreness. That's all released to those inflammatory cytokines constantly being released in our body. We have no glycogen. We have no energy sources to take from. It's causing us to be tired. We have a decrease in immunity. Immunity is regulated in our sympathetic nervous system. So when we have our autonomic nervous system all out of whack, we don't have the same ability to fight off infection. Psychological changes, mood changes, possible feelings of depression and anxiety related to that increase in serotonin levels and imbalance in that aspect, and chronic and recurring injuries. We're not getting back to our needed homeostasis. We're not healing appropriately, and it really hinders the way that we can recover from these injuries and stressors on our muscles. This is also related to immune issues as well. So these chronic and recurring injuries, we're not able to heal. We're exhausting all of our body system's compensatory mechanisms, and respiratory illness is actually another symptom of overtraining syndrome as well. Overtraining syndrome in music performing artists. There are 4 different ways that I have found that we can relate overtraining syndrome and what we do as musicians that can help contribute to overtraining syndrome if found in musicians. 1, practicing. Practicing is our training. Overtraining syndrome is a maladaptive response to training specific related body movements. Where as musicians, we're always looking to build our endurance and technique. The repetitive use of practicing these difficult passageways, these long hours, unnatural body movements, psychological aspect of practicing all help contribute to the stress of training. Music performance, we just continue these motions. Sometimes we have multiple shows a day, sometimes multiple recitals. We have stressful periods in our university training as well that have more playing time than not. And that's when we also increase our psychological needs and have music performance anxiety, or MPA. And it is clearly documented that these physical symptoms increase when performance anxiety is added into the picture. It is also found that a lot of musicians do not have the healthiest recovery methods. The demand for perfectionism leads towards self-sabotage, feelings of depression, and even in a study, 71% of musicians reported sleep issues, and many musicians utilized substances for treatment that only exacerbated existing and pre-existing comorbidities. So what can we do to intervene with overtraining syndrome and help manage and prevent it? 1, rest and recovery, very basic. 50 to 75 decrease in training intensity for 1 to 2 weeks. This can be the amount of training that you do or practicing, so decreasing the numbers of hours playing or decreasing the technicality and difficulty of the music that you're playing. This is a good time to start reviewing your sleeping habits, starting to review, taking awareness of where you're at in your rest and recovery. A big aspect of that rest and recovery is nutrition. We have to ensure that we're having adequate fluid replacement. We have to ensure that we're putting enough protein in our bodies, enough carbohydrates in our body. Those are all energy sources, and BCAA replacement. BCAAs are not naturally found in our bodies. We have to put them there. And how do we put them there? With nutrition. Salmon, eggs, proteins, whole wheat, all of those nice healthy foods help put those good amino acids back into our bloodstream so we can adequately perform and have the right kind of energy levels to perform. Psychological interventions are very important. Early signs of overtraining syndrome are those mood changes as those serotonin levels become imbalanced. That's when we start have the mood dysregulation. Some recommend using a formal psychological assessment tool to keep track of where you're at with your mood. And there can be need for more intervention, such as therapy, group discussion, or speaking to a qualified medical provider regarding a medication regimen. And periodization is something else that is highlighted in overtraining syndrome in athletes, which is planned organization of training load and recovery time. So there's short-term periodization versus long-term periodization. Short-term periodization, for an example, could be I'm going to practice really hard Monday, Tuesday, Wednesday. I'm going to take the day off on Thursday, do a light break on Friday, and then get back into it on Saturday. That's short-term periodization. Long-term periodization is just used over a longer period of time. So you can look at it with chunks of semester, or chunks of year, or whatever you want to do. It's just a planned organization of your training load versus recovery time. So as we've reviewed all of these signs and symptoms and interventions of overtraining syndrome, some special considerations I want you to consider: that these symptoms are signs and symptoms of other deficiencies. And it is always important to talk to your healthcare team regarding the signs and symptoms that you're experiencing, as they may trigger need for other diagnostic evaluation and medical intervention. Symptoms never to ignore. If you're experiencing any of these, please go seek emergency help. Chest pain, syncope. Syncope is feelings of passing out or a decreased level of consciousness. Difficulty breathing, heart palpitations, that could be a fast heart or a pounding heartbeat, psychological manifestations and prolonged anxiety attacks or suicidal ideations, persistent illness and fever. Our immune system is down. Persistent illness and fever might require additional testing and more specific medication regimens. And that's about it. Here are my references. If you have any questions regarding overtraining syndrome, please don't hesitate to reach out. Thank you so much. Goodbye.